Hi, I'm Dr. Richard Brownlee. I'm a neurosurgeon at the Welcome Back MRI and Pain Management Clinic in Kamloops, British Columbia. Today I'm going to talk about degenerative disc disease. So first, a little bit of anatomy about the spine. The spine is made up of three different components. Cervicospine refers to your neck, thoracic spine refers to the part of your spine that has ribs attached, and the lumbar spine is your lower back. So there's 7 vertebrae in your neck, 12 in the thoracic region, and most people have 5 in their lumbar spine. So there's 24 vertebrae in your spine, and between each vertebrae there's what's called a disc. So a disc is like a shock absorber that sits between the bones, and both the vertebrae and the discs are in the front of your spine. So degenerative disc disease is really a bad term because it's not really a disease. It's a process that occurs as we get older. It's like getting gray hair and wrinkles. They're just natural changes that occur in your disc. Most of us are pre-programmed to get these types of changes. They're genetically pre-programmed. Some of it's probably due to wear and tear from what we do in our day-to-day lives, playing sports and some of the jobs that we do. But the majority of it is related to our genetics. So discs have 2 components to them. There's an outer component of the disc, which is called the annulus. And if you think of an annulus as a tire, it's concentric layers of fibrous tissue that attach to the cartilage end plate of each of the vertebrae. And then the center part of the disc is called the nucleus. And the nucleus is filled with a bunch of proteins that attract water. So when we're young, there's lots of water in the center part of our disc. People describe a disc as being analogous to a jelly donut. So if you think of the donut part of the disc as the annulus and the jelly part of the disc as the nucleus, it's that center part of the disc, the nucleus, that contains all the water. So when you're young and healthy, there's lots of water in the disc, so it acts as a really good shock absorber. As we get older, again, it's like getting gray hair and wrinkles, we lose the water content in our tissue and the disc becomes less of a shock absorber and it actually loses height. So as we get older, we get shorter because we actually lose 1 millimeter or 2 in height from each of our 23 discs. And that's what degenerative disc disease is. So it's not really a disease, it's just a natural wear and tear aging process. People often contribute chronic back pain to degenerative disc disease, which is, I think, not that accurate. They're used to believe that the disc was probably responsible for back pain in about 40% of people. However, I think that view has changed over the years. The disc does not have a very good nerve supply, and the disc really isn't mobile, so I don't think it's a very common source of back pain. The facet joints, which are in the back of the spine, and the sacroiliac joints are much more common sources of back pain. I'm doing this talk today in front of our open upright MRI at the Welcome Back Center. One way to evaluate discs is to do an MRI scan. Most conventional MRIs do their pictures with people lying flat on their back. Studies have shown that the pressure inside the disc change with your position. It's highest when you're sitting, and then next when you're standing, and the lowest when you're lying down. So what we found is that when you image people in different positions, lying, sitting, and bending, you can actually see some of the changes in the disc. You can see if the disc loses height, which suggests that the disc is degenerative. You can see if people get what's called a disc herniation, where some of the nuclear material in the middle of the disc ruptures out through a tear in the annulus, and that's what causes sciatica, which is pain in the leg. It's from that nuclear material putting pressure and causing inflammation of that nerve root, and people get pain in their leg. So the MRI is the best way to image lumbar discs to see if there is a pinched nerve or to see how degenerative the disc is. And doing it in different positions gives you more information. In terms of treating degenerative disc disease, there really isn't anything you can do about it. Some people will do fusions of the disc, but that has a very low success rate when it comes to treating back pain, because again, the disc probably isn't a very common source of back pain. So most people that get back pain don't need any treatment for their disc. They need to be evaluated for another source of their pain, such as the facet joints or the sacroiliac joints. And there's other treatment for those conditions. So you can actually treat low back pain. Most people, if they go to a physician, are told you can't do anything about back pain, you just have to learn to live with it, which isn't really true. You can evaluate where back pain is coming from and then make a treatment plan for the people. So that's what I had to say today about degenerative disc disease. You can find more information on the internet, but if you have any concerns, come and visit us and we can give you some more information.